let's go and dive into one of the things that we get asked a lot about sarcoidosis, and that's vitamin D. So vitamin D is actually a misnomer, which is a tragedy because most people don't realize how important vitamin D is. Vitamin D is actually a hormone. And so hormones have multiple effects throughout the body on multiple different systems and very powerful effects. So where do we get vitamin D from? Sunlight. So what happens is there's a cholesterol byproduct in our skin. When we get outside into sunlight, the sunlight hitting it, the UV light hitting our skin causes a chemical reaction, and that starts the pathway of making vitamin D. So then vitamin D comes, it circulates from our skin to the blood, and then it goes to the liver, is partially activated there, circulates to the kidneys, and then is fully activated there. So what does vitamin D do for our bodies? Metabolism, it's very important in metabolism and how we generate energy. Vitamin D is essential for the immune system. And this is why some of the studies that have come out recently on COVID showed such a profound difference in vitamin D. If you had adequate vitamin D levels, you're over 50% less likely to catch COVID. If you do get sick, if you supplement with vitamin D in a certain protocol, that decreased your rate of ICU admission by 97% in one study. And the reason for that is your immune system will not work properly if your vitamin D is low. So all the immune cells have the vitamin D receptor, the key, the lock for vitamin D on them, and it helps regulate the normal function of vitamin D. Vitamin D is also important for our thyroid. We're seeing a rash of hypothyroidism in this country, and a lot of that is secondary to either poor iodine intake or lack of vitamin D. And I've seen a lot of people correct their thyroid abnormalities by correcting their vitamin D levels. And if you look at it, about 42% of the Caucasian population is vitamin D deficient. That goes up to 64% of Hispanics, and 82% of African Americans are vitamin D deficient. And this is probably why you saw a massive disparity in the amount of African Americans and Hispanics that were getting very, very sick with COVID. It's because of this vitamin D. So what is low vitamin D associated with? Just about anything and everything that can relate to your immune system. It's been associated with colon cancer, autoimmune disease, other types of cancer, cardiovascular disease, asthma, respiratory infections. And again, we talked about already about hypothyroidism. It's important for calcium and bone health. So osteoporosis, which is becoming a huge problem. I think, and I can't remember this off the top of my head, I think it's 20 to 25% of people, women over the age of 65, end up getting osteoporosis. And then that can lead to hip fractures, and that can be severe consequences because of that. And that is low vitamin D, but it's also because we're not doing enough weight-based exercise. We're not stimulating our muscles, which helps keeps our bones nice and dense.